We all want to be healthy even without anyone telling us. And then there's Jimmy, who chugs 2 liters of Coke and eats junk food while he sleeps in front of an open fridge. Don't be like Jimmy. Heck, even the government wants us to be healthy to expand the lifespan average of a country or something. But through the years, there have been things done by the government in the health sector that didn't really hit the mark. Prohibition. This happened back in the 1920s, and it was targeted to stop people from using alcohol. Germany could never do that. The government's reasoning with this was pretty funny. Alcohol does crime. Alcohol breaks families apart. Alcohol removes morals. I suggest we remove alcohol from the lives of alcoholics. The government really thought that would work. In January of 1920, Woodrow Wilson, the president of the US back then, put prohibition into working, and it kinda worked at the start. Well, yeah, of course it would work at the start. You completely prohibited alcohol from the country. What would you expect? Of course there would be a decrease in use of it and medical emergencies related to alcohol. But it's like coffee. It's eventually gonna wear off because it's not something that's useful in the long term. And I was right, because people found a friggin' loophole for it. It's not allowed to make, sell, or move alcohol, yes. But nobody said anything about drinking the beer I got a month ago, said some random guy who was probably having a withdrawal after 2 months of only drinking water. Germans. Guys like Al Capone heard about this, and light bulbs just started popping up all around the heads of the gangsters. They finally have something illegal to do other than killing people and kissing each other on the cheek. It's trading alcohol.
Kissing someone on the cheek's illegal?
Yes, because I'm single. The gangsters smuggled alcohol from Canada, which tasted like maple, and some other places. It didn't help that police that time were getting paid low enough to take bribes from bootleggers. Naturally, gangsters will want to have the whole market to themselves. You know, more money. This is a great picture of what happened in the St. Valentine's Day massacre in 1929.
I want all the money.
What? No!
Nice, I get all the money now.
Now there's dead people because of alcohol. There's also dead because of gangs, because of alcohol. There were also dead people because of other things because they didn't have alcohol. In a time that alcohol was not allowed. 1920s America. You were a nice time to live in. Prohibition ended when Franklin D. Roosevelt said it ends. Well, he technically didn't say it ends, but he signed the 18th Amendment that says it ends. DARE program. The entire name of it was Drug Abuse Resistance Education, and the main message of this campaign was basically 4 words: kids, don't do drugs. The LAPD thought of this and managed to implement this on 75% of schools in the US by the end of the 1990s, with the idea that if they get the youth to trust them, they expect that the kids would snitch on someone.
I'm sorry, but this DARE something program is a piece of shit.
A piece of what?
A piece of shit. It keeps bleeping.
What?
It's a piece of, you know what? DARE's not working, basically.
Researchers from University of Kentucky and American Psychological Association even said that it's making children more curious about drugs when it's shown to them, rather than just not knowing about it at all. LAPD even made a slogan for it: just say no. Just say no? Wow. A very perfect way to parent the children that's made up of many different cultures. Very nice. It's a great idea. Don't get me wrong. It's just when it comes to the actual doing. 2009, and DARE became as useful as useless when the Keepin' It Real curriculum was launched. This thing was more interactive than DARE. It was more effective than DARE. And it actually does take the culture differences into consideration. Something that DARE never did. It was like, kids, don't do drugs, but it's more than just a cop yapping in front of the class. The Healthy People 2000 Initiative. This was launched by the Department of Health in 1990 to improve the health of Americans by the end of the decade. It's currently 2024, and I am today years old when I learned about this. From the name itself, it didn't work for shit. It was actually a sequel from the other programs that the first Healthy People Initiative made back in the late 70s, and it had 3 goals: live longer, live healthier, and live safer. Something like that. It's a good thing to test, but the states they planned to implement it to were straight up broke, or did not care about this healthy people thingamajig, because they had more things to prioritize. Healthy People 2000 was also way too ambitious, that the test subjects had that placebo effect thinking that, hey, it's so good, I really hope it doesn't flop. Like that smoking thing. There are many reasons why a person smokes, but Healthy People 2000 was like, no cigarettes for you, congratulations, you're now healthy. As if that solved the problem. When the year 2000 came, only 15% of the goals were achieved. Some of the areas they targeted even got worse, and all I can say about this is a quote from Abraham Lincoln. Those who believe that the Healthy People Initiative will work are either the Healthy People Initiative themselves or stupid. Snooze. It was a campaign pushed by Sweden and was advertised as a healthier alternative to smoking as it decreases your chance of getting cancer. Want me to tell you a secret? There's no healthier alternative to smoking. Anything with tobacco that you put in your body is not healthy. But this was a time before modern vaping, and snus was all about being the vape of its time. Except that you put snus between your teeth and upper lip, and you don't have to smoke it. It was backed by the Swedish government when they showed numbers that snus was used very much, but there are low rates of lung cancer. Introducing the all-new snus. A way out for people who want to stop smoking and a way in for people who want to start. Pick your poison in different flavors today. Also available in water flavor. When the European Union saw that commercial, they were very happy to announce that they're banning snus anywhere in Europe except for Sweden. Not a surprise considering Sweden literally just promoted snus as a healthy alternative. At the end of the day, snus has nicotine, and it's addictive. Nothing they can do about it except yuck. Anti-fat. It was really a thoughtful campaign, if it weren't for the cluelessness of the people that pushed it about anything under the skin. Get it? Anyway, in the 70s and 80s, heart diseases were the bomb, so explosive that it made people either obese or dead. I mean, come on. Oscar Mayer? McDonald's? Coca-Cola? Hostess? Should I name more? These brands and more contained high levels of saturated fat back then. Let's do the maths. So saturated fat plus heavy eating. Yeah, I got heart disease. The US was so alarmed by this that they began to preach for low-fat foods, and the whole country was on board with that. Soon enough, there were low-fat, fat-free, reduced-fat products hitting the shelves, and this was the start of something bad going worse. Low-fat products have low fat. Duh. If it has low fat, it would taste different, and to compensate for the lower amount of fat, the makers of these foods upped the amount of sugar, oh my goodness. The sugar content in these foods were already high. Add more, and you get what? Diabetes. That's right. If you don't want to be heavy, cut some limbs off your body is I think what they want to say back then. But for the sake of pretending to help, they didn't. And this low-fat, no-fat thing didn't even work by a little. It actually did the opposite of what it was supposed to do, since the obese people from 1980 to 2000 doubled in the United States. It's a good thing that today, diet mindsets get a bit more balanced and it's more announced now that no one diet fits all people. HIV/AIDS policy in South Africa. In 2008, South Africa went through one of the worst HIV/AIDS epidemics, but Thabo Mbeki had other plans in mind. When Mbeki got to be the president in 1999, South Africa was already having more and more AIDS cases, and I bet you Freddie Mercury would have done something better than what Mbeki did.
I do not think that there's a relation between HIV and AIDS, so South Africa will not use these antiretroviral things. This is a conspiracy theory like the Earth is round.
But the Earth is round.
Conspiracy theory!
And that's the beginning of hippie era of South Africans. All because of a dude that got influenced by the Flat Earth Society for AIDS. These people, the AIDS denialists, believed that anti-retro-la-la-la drugs, anti-retro-boom shakalaka drugs, hang on, water. Perfect. These people believed that antiretroviral drugs were actually harmful. I swear to God, these people are anti-vaxxers too, and it's because of President Mbeki's decision that millions of South Africans with HIV got delayed medical help. This dude didn't learn his lesson, because in 2008— Hold on. Let me tell them. Yeah, I let 330,000 people die from AIDS because I delayed the ARV drug. I was controlled, okay? I thought those denialists were right. Are you forgetting something? Yeah, 35,000 babies had HIV when they were born. Yes, and the dead would have still been living today, and the babies would have not gotten AIDS if he acted immediately. When Thabo Mbeki was ousted in 2008, thank goodness. By then only that South Africa did better on HIV/AIDS response. Swine flu vaccine. It all started with a death. A recruit in Fort Dix, New Jersey just died. Haha, Fort Dix. Everybody thought it was because of the flu. They weren't exactly wrong. They weren't exactly right, too. If it's the flu, it would have been ruled out since this happened in February of 1976. At least that much can be said. Later on, after testing other soldiers, it was found that the type of flu that killed the recruit earlier was a H1N1, almost the same one as the Spanish flu strain. That thing killed millions 50 years before this, and probably reappeared in 1976. Of course, it's bound to burn the hairs of US health officials. The entire administration was like, oh no, you're not going to fool us twice, and dramatically overestimated the size of what it could have possibly been. They ultra-upgraded their health stats a month after, and my guy Ford announced the National Immunization Program. Vaccines were massively produced and distributed as fast as possible, that the government spent the price of 5,400 houses in the 1970s to execute it. How come the action here was fast than when COVID happened? The heck? I'm telling you, the speed and the sense of urgency was the only good thing in this. Because from the get-go, no testing equals no percentage of it being effective. They legit spent $135 million for the cure. For the cure. Like the actual cure. They didn't bother to test the cure. Just $135 million gone. For the cure. Fishy. By fall of that same year, injecting people vaccines with questionable effects was in full force. All right. The questionable effect got answered. Answerable effect. The effect was Guillain-Barré syndrome, a disorder that causes you to move super weak, if not paralyzed. As the number of people being vaccinated increased, so did the number of people that got Guillain-Barré syndrome. I sure hope it stops here. How bad can it possibly be? I'll answer myself. So bad. The flu that the government feared so much did not turn out to be at a pandemic-level virus. It was an flu, and no outbreak was ever reported out of Fort Dix since the recruit died. Ha, Fort Dix. After that, the government just said whatever and stopped the vaccination out of nowhere. 40 million people have been injected of whatever in their bloodstreams, and just like that, poof, nothing. USA just conveniently walked out the door, pretended nothing happened, and said, okay, Cold War time, baby. But you can't expect to walk out of that just fine. Lawsuits, of course, came down raining from those the vaccine affected. That's what you get for believing in Murphy's Law, pellagra. It's a disease that you get when you have a boring diet. Imagine eating corn for breakfast, lunch, dinner, and midnight snack. Nothing else, just corn. No doubt you'll get pellagra from that. You'll be able to recognize if it's pellagra with these 4 Ds.
I wish I had 4 Ds.
What? No. The 4 Ds are dermatitis, diarrhea, dementia, and death. What Ds were you thinking about?
D's nuts.
This disease affected a lot of people back in the early 1900s way down south. People with pellagra had skin wounds, overall weakness, weight loss, and mental spacing out. Since people didn't have knowledge about this back then, they thought it was contagious. Well, to be fair, every sickness back then was thought to be contagious, so this wasn't special. Because people understood it that way, that time, the public only had one solution for it. Quarantine them, which actually made things worse. See, it's not going to get better if the diet was as boring as corn. The states that were affected by pellagra were actually not a food planting state. They were more of an, I plant something not edible but I can earn from it state. You know, cottons, tobacco, all that stuff. What does this mean? It means they're poor. So pellagra became the poor man's disease during that time. And it stayed that way until this doctor right here named Joseph Goldberger saved them some time between 1910 and 1920s. So it's not because of a virus? I see. It's more of an eating thing. What do these people eat? Oh, what a sad and boring diet. For real though, because in the 1930s, it was found that pellagra can be cured and even stopped from coming. You put vitamin B3 in flour and you're now okay. Victorian London cholera. Back in the 19th century, London was built on three things: a growing industrial force, the royal family, and the smell of fresh air from River Thames that will sure to leave you all puking. This was actually what people believed to be the cause of cholera in London back in the 1800s when this was introduced to them. They started thinking the awful smell was coming and rising from the ground because of all the rotting things. I'm gonna clean the streets today, Freddy. What are you planning to do?
I'm planning to kill a man. Put a gun against his head, pull my trigger, now he's dead.
This miasma theory held on to the beliefs of people for a pretty long time because there was no actual evidence that cholera came from somewhere else other than believing that it came from the ground. And throughout the years, there have been so many outbreaks that happened in London alone. And all outbreaks pointed the blame to the fart cloud that surrounded the city, so they just kept cleaning the air. It's a good thing that in 1854, Dr. John Snow looked deeper into this bad air thing. Did John Snow really look like that? Was he poor or something? After some investigation, he eventually found out that it wasn't the air. It was never the air. It was the water that killed thousands of people. Well,
We just can't accept that. You got some really nice proof here, but we're not just gonna believe some research-based conclusion over our unproven theory.
I can lower the cases in this city just to prove I'm right. I'm not even gonna raise a finger. Then he told the council to remove the handle of the Broad Street pump, and the cases got lower. Dengue vaccine in Brazil. Dengue is a disease that countries in tropical countries normally have. You get it when a mosquito bites you hard enough to give you a skin bump. People with dengue have high fevers, headaches, muscular and bone pains, then some rashes. Now, sometime in 2016, a vaccine that was promoted as the one that will stop dengue was launched by Sanofi Pasteur? Oh, Sanofi Pasteur. Why did it have to be a French name? Anyway, the name of this vaccine was Dengvaxia, and it was backed by clinical tests and all that. But, the trials didn't tell the entire story and left people in more danger than do the job of the quote-unquote vaccine. Those results were nice. Give me about 200 million of them pokey-pokies to veiny-veinies. Obrigado. Millions of Brazilians have been injected with Dengvaxia with the hopes that they'll be a little bit safer from dengue, if not totally immune to it. And a large part of those millions were children. But guess who didn't study enough? It's you for your finals exams. It's not only you, though. Sanofi Pasteur also didn't study their vaccine well enough that some studies said that it can only help prevent dengue in people who already got dengue before. Don't tell me. Oh yes, I'm telling you. Those who never got dengue have more chance to get the worse and more deadly version of dengue if they got one after the vaccine. And it's not like you can tell if one got dengue before or not on 206 million people. These things were found out when millions of innocent Brazilians that just want to get safer have already been injected. I don't know about you, but that sounds like a bio-war movie plot for me. After that, it was just a series of I'm passing the phone to someone who I can blame. Witch trials. What? Witch trials? In the late 17th century Massachusetts, people were highly Jesusified with their beliefs, and the justice system was, well, unjustifiable. The one to blame for this uncivilized behavior was the Puritans.
Is that a Puri what now?
Puritan. It was basically an English Protestant who wanted simpler beliefs. So yeah, it was their fault that the people of Massachusetts were like that. When the young girls in the area suddenly went rada rada rada, then screamed and threw stuff around and did their didgeridoo speaking impression, everyone was like, what are they doing? Should we tolerate this stuff? So they turned to Samuel Parris. With the authority that he had and the bias because his daughter was a part of the affected, he stood up to the post.
Since we don't have the technology of the 21st century, we cannot say that what these little girls went through was just them being hangry. So we only have one thing left to believe in. Witches.
Now everyone thought that witches were the public health hazard. They were just hangry, man. Hangry. Then the girls pointed out three women, Tituba, Sarah Good, and Sarah Osborne. I want you to guess in what way are these women the same. That's right. They were poor, and if they're poor, they're easy targets to put the blame on, and they can be easily eradicated. How about a game of pretend where the people really wanted to kill the person in trial already, but they want to look civilized, so they add an extra step of a very biased trial? Yeah, they played that game on the three women. The trial was so unbelievable to the point Jesus Christ would say, "I didn't make that stuff," or something. How can you prove that these old, poor, close to dying, weak, almost useless to our town women are the witches?
I saw their spirits doing witchcraft.
What's your source?
Trust me, bro.
I already believe you because your source was to trust you, but do you have any other proof?
Right now, my daughter is affected. She would be better if she touches these witches.
Your daughter acts bad, but your sources trust me, bro. I can't deny that. They're witches. Hang them! The people of Salem enjoyed hanging the innocent so much, particularly this guy, Chief Justice William Stoughton. He was laser-focused on getting to the bottom of a disease that did not exist, which was witchcraft that he told the jury to find every poor dying woman accused of witchcraft to be guilty. 19 poor, weak dying women hanged, and one man pressed to death later. The governor followed his wife, who told him to demolish the most unfair court in history of mankind, and created a physical evidence-based court. I guess the real witches were offended by the fact that everyone thought they were old and poor when they lived in a mansion and just turned 18 years old that they gave Salem the smallpox the time witch trials were being done. Man, I sure do hope nothing else like this happens in the future, even though I know there will be.